Hi, my name is David Hope and welcome to this class on type 2 diabetes. I want to go over some of the things that we're going to be talking about during this class. First, we're going to start with discussing some healthy food choices and how high sugar foods can affect the body. Next, we're going to identify several risk factors associated with type 2 diabetes. And finally, we're going to talk about prevention techniques and how people can relate those to their own lives. A healthy diet is one of the most important things we can talk about when it comes to diabetes. First and foremost, we want to talk about complex carbohydrates. These will help regulate our blood sugar and give us energy throughout the day. An example of these will include wheat bread, brown rice, sweet potatoes, and other foods such as that. I will now take the time to pass around several foods to the class and have them categorize them as healthy or high sugar foods. Following that, we will discuss our answers and go over the correct options. Now we can talk about risk factors that help lead to type 2 diabetes. These will include smoking, high blood pressure, high fat cholesterol levels, being overweight, and having a sedentary lifestyle. It is important to know these risk factors in case any of these apply to you or any of your family members. Now let's talk about ways we can prevent diabetes. Let's start with exercising 30 minutes a day, 5 days a week. This can really help keep our heart healthy, our blood pressure low, and it'll really even help regulate our blood sugar, which is one of the main causes of diabetes. As we already talked about, a healthy diet is very important. Let's start eating more whole grains and stay away from those simple carbohydrates like high sugar, donuts, and such things like that. We really want to also stay away from any kind of cigarette smoking, which this can help restrict your blood vessels and increase your blood pressure. And then, as we already talked about, keeping your weight manageable. Does anybody have any questions? The first question is, how do I know if I have diabetes? Diabetes may cause no symptoms at all, but some signs include frequent thirst or hunger, having to urinate more than usual, losing weight without trying to, fatigue and crankiness. Sometimes you might even feel a little numbness in your extremities. Can diet and exercise really prevent diabetes? Yes, exercising and eating a healthy diet helps keep off excess weight, which can prevent or at least delay diabetes. If you already have diabetes, doing aerobic exercise and resistance training helps by encouraging the muscles to take up more blood sugar. What is the difference between type 1 and type 2 diabetes? Without getting too technical, type 1 diabetes is usually something that you're born with and is an autoimmune disease that destroys insulin-producing cells in the pancreas. The difference is type 2 diabetes is something people usually get later in life and is caused from your body losing sensitivity to insulin, the hormone that helps muscles absorb and use blood sugar. Learning activity 1. In this activity, I passed around several foods for the class to categorize after we covered the healthy food section. I wanted them to be able to use what they've learned and be able to identify foods, whether they are high sugar or healthy for you to eat. The method I used for this activity was problem solving. Learning activity 2. Towards the end of the class, I will separate everyone into groups using the number method. I will then give each group a situation to apply what we learned throughout the class. This may include a diet change, increase in exercise, stopping a risky behavior that would help increase the chance of diabetes. After every group has worked on this for several minutes, we will discuss as a class. The method I'll be using is cooperative learning, and it applies to interpersonal and kinesthetic learning.